So this is still the Ways and Means Committee room, though we were not here for a while. It is 10:35 on the 23rd. When last we were gathered, Representative Burkhart had a question. I don't know if she still does.
I still do. I
Great.
still do. My question was about the exclusions from the federal investment income tax, as well as what we're now saying would be exclusions from the state level one. And that is for folks who are in the property business. So they're actually renting property as their active business. How is rental income taxed for them? So it's sort of in this bucket of things that are considered passive income. But are they taxing actual rental revenue, or are they taxing net income from a business like that? I'm trying to just understand like how a property person would be trying to pay, their maintenance expenses and their employees and all of that if they are trying to rent apartments, for example. That probably would have, yeah, probably would have.
Kirby Guillen, answer your question. It applies to the net rental income is the term that's used, or as far as the ongoing rental income. It also would apply to the sale of rental property, unless it qualifies as an active trade or business, which gets deeper into the weeds of income taxes.
Yeah, so I was just trying to understand for a property business where that line was drawn between an active business and a passive quote unquote business. I mean, I guess I can take it offline and get deeper into the weeds offline, but
Sure, I think the general answer is that rental income is generally considered passive though.
okay. All right.
And
Thanks.
it's the net after all your stuff.
Yep. Got it.
Representative Odie, we only have a few minutes with Jen, so I want to go to her if that's okay with you, and then we can look back to other folks in the room. Jen, do you want to join us? Sure. Thanks. So remember we looked at the changes in the revenue coming in. We talked about one way of using that revenue to lower costs for middle class Vermonters. Now we're going to look at a second scenario of how that revenue could do that.
Great. Good morning, Jen Garvey from the Office of Legislative Counsel. So there are 3 proposals in this language, and I'm wondering, Madam Chair, if you want me to just go through what they are without a whole lot of context, in which case we won't have the context, but we'll probably get through all the language, or do you want to go more slowly and come back to
this? Context is great. So we'll just maybe not be complete.
Okay.
Yeah. No one's voting on this tomorrow, so we have time to figure it out together.
Okay, great.
And Emma, you have to leave at 10:32-ish.
She fell in.
Okay, you're together. Okay, great. Okay.
We're both going down to Senate Health and Welfare.
Okay.
All right. So here is language that we are looking at on some healthcare proposals. The first one has to do with premium assistance. So financial assistance with the premiums for qualified health plans, which are plans offered through the Vermont Health Benefit Exchange, which you may know as Vermont Health Connect. So I want to start with existing law because it sort of affects why this new language will go in. So the existing law in this section provides Vermont premium assistance to an individual or family who's eligible for federal premium tax credits, who has an income of up to 300% of the federal poverty level. Under federal law, there are advanced premium tax credits available on a sliding scale to people with income up to 400% of the federal poverty level. And Vermont, for many years now, since the beginning of the exchange, has also done an additional Vermont premium assistance for some of those people, for the people under 300%, so not 300 to 400%, but under 300%. And under our existing law, the Department of Vermont Health Access has a premium schedule that's on a sliding scale based on modified adjusted gross income for these individuals and families. So those who have income less than or equal to 300% of the federal poverty level. And the department reduces the premium contribution for these individuals and families by 1.5% below the amount that the federal advanced premium tax credits sets their premium at. So this is existing law. This isn't changing in bill. And pull something else up to give you a little context here. As you may have heard, there were some advanced premium tax credits available through as a result of the ARPA, the federal act around COVID, and that increased the federal premium tax credits and increased the people for whom those were available. So I'm going to show you 2025. So this is based on the instructions from the worksheet, people filling out by hand on Vermont Health Connect. This is what their 2025. So before the advanced premium tax credits, the enhanced credits expired, this is what was available. And what I want to show particularly is that for people between 300 and 400% who don't get Vermont premium assistance, setting a cap on their premium at no more than 8.5% of their income, their modified adjusted gross income. And for people above 400%, they also had a cap where they would not have to spend more than 8.5% of their modified adjusted gross income on health insurance premiums for these qualified health benefit plans. So taking that one down for a moment, then we have where we are this year. That was the 2025 form, the 2026 form. You can see for people over 300%, but not more than 400%, the federal level has gone from what was 8.5 to 9.96% of their, so almost 10% of their household income. And there's nothing for anybody over 400%. It's whatever percentage of their household income it is. There's no cap. So that's where we get to the language. Going back to this new language, this draft would say no individual or family, regardless of their income, shall be required to pay more than 10% of their modified adjusted gross income for the premium for a qualified health benefit plan in the individual market based on the cost, and this is always tied to the cost of the second lowest cost silver level plan offered through the exchange. This is in federal law, and we carry the same thing through in state law to identify sort of a standardized amount across the board, second lowest cost silver level plan offered through the exchange. So nobody will be required to pay under this proposal more than 10% of their modified adjusted gross income on premiums. And it directs the Department of Vermont Health Access to provide premium assistance to affected Vermont residents who are purchasing a qualified health benefit plan in the individual market through the exchange by reducing their required premium contribution. So putting on a cap by an amount equal to the amount by which the cost of the second lowest cost silver level plan offered through the exchange for their applicable household size exceeds 10% of their modified adjusted gross income. So this is trying to kind of put back that idea of the similar to the 9.96, but 10% cap for anybody who would be affected by that. For the people who have lower incomes, they would already be getting a better deal under the state and federal combined premium tax credit. So they probably would not see a benefit of that. And then it has a further limitation saying that premium assistance is only available, and this is consistent with the federal and Vermont law about who gets premium assistance, only available to individuals and families who either don't have an offer of minimum essential coverage or that meets the Affordable Care Act requirements from their employer, or they do have an offer of minimum essential coverage from their employer, but under federal standards, the coverage was either unaffordable to the employee, so it would have cost them more than a similar percentage of their income, or did not provide the required minimum actuarial value. So this is to avoid anybody trying to drop their employer coverage and go on and get this benefit from the state instead. So that is the first section. Maybe I can give you
We have 3 more minutes with you.
one more minute and they're ready for it. But the second section, and then maybe I will actually turn it over to Kirby to do the third one since he drafted the third one. So the second one is a further income threshold increase for the qualified, for the Medicare savings program. So under current law, people who are on Medicare and have, so not Medicaid, we haven't talked about Medicaid, but here we're talking about Medicare. People who are on Medicare and have in household income below 150% under current law of the federal poverty level, and this has been increased a couple times over the last few years, are eligible for the qualified Medicare beneficiary program, which helps them with their premiums for Medicare and their out-of-pocket expenses, and also makes them eligible for some financial assistance through the low-income subsidy program, federal program. So these are all, so this would increase that threshold to 200% of the federal poverty level, and it would direct the Agency of Human Services to increase another threshold, the qualifying individual program threshold, which is for people with higher income than qualified Medicare beneficiary program, still not high income. Increase the qualifying individual program, the QI program income threshold to the maximum percent of the federal poverty level allowed under federal law based on this increase. So there's this proportional relationship between how much we increase the qualified Medicare beneficiary program, the QIMBY program, that affects how much we can increase the threshold for the QI program. So this is looking at increasing the income level at which people could on Medicare could get financial assistance with, depending on which of these programs they're eligible for, premiums on Medicare and cost sharing or just cost sharing.
Thanks, Jen.
Yes. Come back with,
We'll have you back soon.
all right, great. Trying to make sure I'm
The fire alarm Thursday to you.
sorry about that.
No, it's not you. It's not.
Thanks.
Hey, tagging in for the rest of this. Kirby County Legislative Council, we have one other part of the document that Jen was walking through. This, let's see if it. Yeah, came with me. So Jim brought you through in this, we have some, what are we calling it? Wayward language here for you. You don't think we should?
No, it's funny though. I like it. They're kind of similar, I think, in there, questionable.
Some unparented language here. Second, Jen was walking through A and B. We are now in section C. We just like to be random and
Let's just call them amendments.
what this language does is creates a new income tax credit in Vermont, oriented towards businesses. It's drafted to be non-refundable credit against the income tax, an amount equal to a to be determined percentage of the premium cost paid by a qualified employer for its employees in the taxable year. So you're probably asking, what's a qualified employer? Qualified employer is a business under, this is the definitions under the Health Benefit Exchange statute, which is a business with 100 employees or fewer and get this out of my way. 100 employees or fewer, and has a principal place of business in Vermont and elects to provide coverage for its eligible employees through the exchange, regardless of where an employee resides, or has 100 employees or fewer and elects to provide coverage through the exchange for all of its eligible employees. So it's that definition plus the employer pays 50% or more of the premium cost for its employees. So for those businesses, they would be eligible to take this credit, and it would be for a percentage of the premium cost that they pay for their employees on the exchange. We also have a provision here saying that the credit could be carried forward up to 10 years in the case that there's not, that the credit's larger than the tax liability in a given year. To give you some background, for purposes of, putting this idea out here, it's being called the small employer premium tax credit here. There is something called a small business tax credit at the federal level, which has different components to it. I bring that up to say that it has aspects of it that are not incorporated here, just so you're aware of some other ideas for credits like this that exist. For instance, the federal credit, and this is why I was bringing it up, a credit like this could be taken by a tax exempt organization that has employers that are providing coverage for, but it could be a tax exempt organization that doesn't end up owing any tax because they don't have unrelated business income. They don't have any kind of activity that would create income tax liability. So at the federal level, there's some additional options that can make it refundable in that case. And it's basically refundable to the extent that it could cover payroll taxes and things like that for the employer. That's not here. Just to make you aware. So the way that this is currently drafted as before you is more towards businesses that have a tax liability. It's non-refundable and it's carried forward up to 10 years.
Sorry.
A little slow. Could you say that again? I think, and with an example, I think, for example, a nonprofit would not be able to use this, but a
nonprofit would be able to use this if they have unrelated business income. If they have a tax liability of some kind based on their operations, but not all of them would be. And that's why I was flagging it, so that you'd be aware of the universe of employers that this language would cover.
So this is tied to income. It's not tied to payroll. I'm getting what you're saying.
Yes,
I gotta hear what you're saying. Okay.
it's tied to
Next, you can apply.
premiums paid and to an actual existing Vermont tax liability. There's also a provision here in sub D that would allow Department of Vermont Health Access to share some information with the Department of Taxes for purposes of administering this. And then in section D down here, under the tax confidentiality statutes or tax information confidentiality statutes, there's the existing provision that allows DEVA to receive information from the department. We've added and to administer the tax credit available that we just walked through, so that if tax needs to share information with DEVA in order to get what it needs to administer this, that would be allowable sharing of information, sharing of tax information. And this entire package is drafted assuming that it all would take place January 1, 2028.
Once the revenue is available.
That's it for the healthcare side.
Yeah, thank you. When you said once the revenue's available, meaning we may revisit this if there is no revenue, is that what I understood you to say?
No, that because it's a change in income tax, the revenue is somewhat delayed in arriving in the state.
Okay, thank you. Got it.
Coffers.
Make sure I understood what you're saying.
Yeah,
Could you just repeat what you said a couple minutes ago about the piece that's not in here about potentially refundable?
Sure. So there's the federal tax credit that's kind of similar, but it has a lot of different pieces that are different. And there is a component of that that accounts for tax exempt employers to be able to receive a refundable credit because they have no tax liability.
Okay.
There's no component of
Okay.
That here.
Okay, yeah, okay.
and so I'm kind of talking outside the bounds of the language,
Yeah.
but it was to try to help you contextualize and get an idea of the universe of the employers.
So how much is the federal tax credit?
Good question. It's based off of something different. It's not based off of premiums paid.
Okay.
I could,
We can cover that later, but.
it's, it's quite different. It's a much smaller employers it applies to. It's fewer than 25 employers. There's also requirements based on how much the employees can be made or can be paid, I mean. And so that's not a component of this where if you pay anyone over a certain amount, you're not available or it's not available for you. That's not a component of this. But it's a tax credit of up to 50% of premium costs. And then for the tax exempt organizations, it's only 35%. And it's to qualify, the employers must pay at least 50% of employee-only premiums through a marketplace plan. So really it targeted quite differently than the language we just walked through.
Can you send that link to
Yeah,
in not.
This-
The hassle.
and it's called- sure. I'll send you an IRS description of the small business healthcare tax credit. That's called.
And the number of employees, I missed it, I know you said it, but I missed the number that these folks have to qualify. It says small employer, but it didn't sound like they were all that small.
So for the language we're looking at, it would be 100 employees or fewer would be considered a small employer for purposes of this credit.
Thank you.
Representative Bodie?
Thank you.
Can you say what percentage of employers in Vermont are 100 and under?
Kevin Shu, who's coming next, might actually know the answer to that question. No, it's not why he's coming.
Okay.
Also Google. Anyone else have questions for Kirby? Do you have other things you want to say, Kirby?
Not about this necessarily, but were we going to segue like?
Oh, yes, thank you so
Here.
much. And a segue.
So there's other
Would you like me to say?
iterations of different language that I can show you.
So the second amendment that I talked about, right, there's the healthcare spending to reduce costs to Vermonters, and then there is just straight up reducing taxes across the board. Pat showed us the numbers on that. Kirby has the language.
Oh,
Do you want to show us that language?
Start here. I think this is what the chair mentioned. So tell me if I'm showing what you wanted me to. I have a version of language that does not affect lower brackets and that only increases the rate on the upper bracket.
But lower than the other bracket was increased. It's lower than the last time we looked at it, though it is higher than the
Yes.
current law. Yes.
The last time we looked at this, the highlighted 12.7 there was 13.3%. And so we do have a version that does that. And again, does not affect the lower brackets. For purposes of our review right now, the estates and trust brackets are not changed from before. And this language also for the Vermont investment proceeds tax includes the things that have to be added back to net investment income, things that Vermont can't tax. Or decrease by, rather, I shouldn't have said added back, that further decrease the investment proceeds base. But all of the add backs that we had looked at before are removed here. So this is as close as Vermont could get to the same tax base as the federal.
And so this is sort of like, I guess, a base amendment to what we looked at in language previously. It's amending how we're raising the revenue in order to narrow the scope of it slightly. And that Pat talked us through when we started.
So if you recall, when we looked at this before, stuff like qualified small business stock gains were being added back because those are left out at the federal level. This language does not do any of that. All of the, I think we walked through 7 or 8 different proposed types of income to add back to the base that's not taxed at the federal level for the NIIT, but that's not here in this language.
Kirby. Am I looking at a different draft? I got another paragraph of
Probably.
highlighted.
Probably. There's a few things posted under my name. So what I'm showing you right now would be Amendment 1. So this version does that. And that's all. And we don't have the healthcare stuff included here. And I didn't change the effective date for the healthcare. So this is the same effective date as we had before, but again, just. Now I can move on to the second version.
Thanks.
Okay. So we also have a draft that, once again, does not affect the lower brackets, has 12.7 for the upper marginal rate, and removes the things we were just discussing before, same as before, when it comes to the VIP tax, and does include a way to spend the revenue, some of it. So the section 3 of this language would be the first item that Jen walked through. And then section 4 was the second item that she walked through, increasing the qualified Medicare beneficiary program income threshold. And then the tax credit that I just walked through with the tax confidentiality amendment. And then an effective date of January 1, 2028 for all of it.
Thank you. Yeah, Representative Muscle.
Could you go back up to the way to spend the revenue? I heard you say it, but it slipped right through.
That's okay. It's if this language just has the 2 changes that Jen walked through.
Right.
And then it has the tax credit that
Okay.
I walked through.
Okay. Thank you.
Yep.
Tax rate on both of those for estates and trusts is still at 13.3. Up from what it currently is, but lower than 12.7.
Yeah, and I flagged that to say that that's just left alone for now, but I wouldn't presume that it will stay that way. So the third version, which is I think saved us 3.1 of the actual committee amendment. So this one's not labeled as Amendment 3. What this does is all of the pieces that have been discussed this morning are coming together. It is the 2.7% rate for personal income tax lowest bracket. being changed from 3.35 to 2.7. And with the amount of tax that's due associated with that being changed all the way up to the current highest bracket with the rate being changed from 8.75 to 12.7. So as Pat covered with you, effectively it means people with taxable income. We're looking at married filing jointly in this case. If you're married filing jointly and your income is below 625,000, if your taxable income is below that, then you would be paying less under this. And if your income is over that, you would be paying more Vermont income tax.
So this is the language to match the table that Pat showed us.
Mhm. So head of household, you see the 12.7 starts at 534,175. Single filers.
And just to remind myself, the way the brackets are in statute, like there's an inflator that's sort of not clear in statute, so that those leaps look like bigger leaps than they are in real life.
Yes, as we talked about before, and interestingly, because it's been so long since the statute's been updated, it looks like an increase for these lower brackets, but it's actually not.
Decrease.
It's because these numbers should be inflated.
Right.
And they're not here.
That's delightfully confusing.
Yes. Yes.
Okay.
So there's those changes, and then the rest of it is the same as what I showed you before. It's a version of the VIP tax with nothing being added to the tax base, and the healthcare pieces that we've talked about.
Thank you. Without the healthcare pieces. Without the healthcare pieces.
That version had the healthcare pieces.
Oh. Okay. Did that version not have the healthcare pieces? Thanks. Thank you. So Pat took us through the numbers part of how we raise the revenue, and one option for using that revenue to offset taxes for middle class Vermonters. Nolan is going to share a few thoughts about the healthcare premium assistance tax credit side. Just so we can make sure we have as many staff people as possible for this confusing conversation.
Okay, did we get a sense as to how much is coming, would be raised from the net investment income tax?
I think we did, but I don't remember what Pat said.
It's not. It was originally 58.6 million, or something like that.
So Patrick Tierney, joined fiscal office by removing some of those additional pieces and more closely matching. The federal version, the estimate for that would be about 48.6 million. So that'd be us down from what you saw previously.
Hey, Nolan.
For the record, Nolan Langwell, the Joint Fiscal Office. I don't actually have a lot to say. I'm just here, I assume, to sort of help folks understand the healthcare piece of who this might impact in terms of beneficiaries. So there's still a lot of unknowns, but I can tell you the known knowns. I feel like I had to say that. It's either that or say Wayward in support of Kirby over there, but all right. So what I have here is there's quarterly, there's monthly. Health, Vermont Health Connect puts out these numbers of how many people are covered. And so what I did was I showed how many people were getting state and federal subsidies only, or no subsidies on the individual market pre and post. So pre and post December 31st. So prior to December 31st, folks were still getting the federal premium tax credits above 400%. And afterwards, those expired. It wasn't actually part of HR1, as Jen mentioned, it was actually part of ARPA and then IRA, which is I forget what that stands for. Thank you. Which was extended then. So, and HR1, this was not an HR1, but it was as HR1 did not address this.
Mhm.
So they expired. So this is sort of pre and post expiration. So you can see total folks in the QHP on the individual market in September, at the end of September was 32,000. As of January 31st, 2026, this is the most up-to-date information I have. That's why it's only January. It was 30,000. So we know that about 2,400 people came off. Where you really start to see the difference is when you look at the federal subsidy only. There was 9,272 people that lost federal subsidies. And then you can see that there was 4,500 people that have no subsidy that increased. So it's possible that some of those people went from federal subsidy to no subsidy. What happens is it's like I always say, shake up the snow globe. So some people went from federal subsidy to no subsidy. Some people went from federal subsidy to just uninsured. We just don't know where they land. Surprisingly, there was a slight uptick in the under 400. And those are the folks that are getting both state and federal. I'm not sure what that is counted. It could be the economy. It could be a lot of other stuff. But really, I'm just trying to help you understand like how many, you get a sense of if there were some kind of assistance, how many people could this potentially affect?
Just for example, so when you say 4,568, are these plans or are these individuals?
These are individuals.
Okay,
Sorry, I should have been clear. These are folks. These are lives on the exchange.
so it's not family.
These are the
It's for
individuals. Well, no, this could be a family. So it's the Indian. So this is where it gets clear. There's two types of markets on the QHP on the qualified health plans or on the marketplace. You have what's called an individual plan and a small businesses. So the individual plans could be families, but they're people who don't have insurance through their employer. And so if they're under 400% of federal poverty, they're getting some kind of state federal subsidy because they're not getting a subsidy from their employer. That was the idea behind creating the subsidies in the first place for the exchange.
So I'm sorry, I'm not understanding now. So an individual plan,
Could be a family plan, but it's individual means they don't have coverage through their employer.
but so how do we know that it's 4,500 people and not 4,500 plans? Like it
It's
could.
lives.
Okay, so so when you say, okay, so we're talking about lives covered, we're not talking, so that 4,500 people could be 3,000 plans.
It could be.
Just trying to make sure.
No, but it's a good question and I should label it better. The other impact, and this is based off of DEVA did an impact analysis back in January of 25. So this is old data. They had hired a company to say, what happens if we lose when the stuff expires? And their actuary said that they estimated that federal subsidies were worth about $65 million. I say or more in parentheses because there was some DEVA report, there was some reporting in Digger that said actually it might be 75 million. I don't know. We don't know. This data is a year old, but it gives you a sense of how, because part of the reason we don't actually know is because the federal government is the one they were the ones providing this program. So the state was not involved at all. So we don't know how many people were getting these federal subsidies or how much the federal subsidies are worth. We can only look at how many people do we know no longer are getting this information from based on these reports. So it's estimated that the federal subsidies were somewhere between $65 and $75 million in that current version of the bill. And so what happens when the subsidies go away? We can assume that resulted in increased premiums for paid beneficiaries. That much we know. And then the number of uninsured very likely increased. The other thing I want to show, this is what Jen was showing you before. This is the chart on the left side is what was in the Affordable Care Act prior to this enhanced subsidies and now the world we are in now. And then the enhanced, so you can see for folks in the lower income, some of them were getting anywhere between 2% and 4% of their income, that would cap, it went down to 0. So it didn't just help people that were over 400%. It reduced the premiums for those who were also getting it further. So it shifted things, not just for the people who are on the higher income brackets, but it lowered some people went from a little premium to zero premium at the really low income level. So I just wanted to kind of flag that. So this is just sort of a high level. This is the population that could be affected if you were to do something.
So people across sort of all brackets had their health insurance costs go up. And by applying the language that we got from Jen, it would see them all go back down again.
I assume, but I don't want to answer a legal question
Yep.
without my attorney present.
Any other questions for Nolan?
So this might be a thick question, but big on the last slide. So if we were to proceed with the language that Jen presented, how many of these lives would benefit?
Great question. The answer is, we don't know. We could assume that depending on how you apply it, there's a lot of moving pieces, but you could assume that many or most of the people that were receiving federal subsidies would likely get some subsidies back. Of course, their financial situation change. There's all kinds of moving factors, but we can assume that it's going to be in the ballpark, give or take. The other things that I should feel like I should flag too is that because, as I mentioned, this is fully implemented by the federal government, not the state. If you were to do something like this, the state would have to stand up a very new program. Now, they have a lot of the resources, but they also would need further resources because this is a new program. So there would probably, tax department would very likely come in and say, we need X amount of FTEs, we're gonna need IT money, we're gonna need this, that, and the other. So fortunately, I think the effective dates are not for another year and a half or so. So there's time for them to sort of come back, figure out what their needs are, what the costs would be to stand up, and also do an analysis to figure out how much money would actually be needed and how many people will be affected. So this is very early stage of a lot of unknowns.
Talk about monies that we would have to raise. We're looking at 65 to $75 million.
I think it depends on how you structure the program. And again, I don't want to put a number out there because I'm not an actuary. I can't say, okay, here's what the language does. All I can do is say, here's what an old study said would happen. That data is over a year old. That's why new studies or tax department, whoever would have to sort of do a new analysis to say, what does it really cost? And how many people would really be affected? I can just tell you what we knew. I can't tell you what the future will be. I mean, it's the right question that we just don't have answers yet.
Has JFO ever done an analysis of comparing the benefit of reducing the cost of healthcare generally, and whether that has a bigger and more direct impact, both economically and on human well-being, than broad-based tests and check scales?
No.
And if we don't do this, given some of the early indicators you're seeing, what are the knockoff effects? What might we see in terms of patient access to care, uncollectible debt? Are there other things that we might be looking at as indicators of how this loss of subsidy might play out?
I just want to say yes and leave it at that. No, my point is you're asking all the right questions, and this is the bigger problem. This is the bigger conversation about what is happening in healthcare. You know, healthcare, as everyone knows, is becoming more and more unaffordable. Premiums are going up, costs in hospitals are going up, all the costs are going up. And so, as we know, healthcare is a big part of family incomes. We know it's a big part of business expenses. We know it's education expenses. And I think that, and I know that the healthcare committees and other committees are trying to figure out how do you curb costs. You're not care board. So I think it's all those things, like, you know, in the absence of nobody doing anything, it's just going to become more and more a burden and more unaffordable. So will this help the bigger problem? It'll help these people. It won't solve bringing down underlying healthcare costs. It just will help people make it less unaffordable for people to be able to get their healthcare. I don't know if that answers any of the questions.
I think partially. I think the question I have is what are the I mean, part of it is a timing issue, right? I mean, there's some things that have gone on in this body to try to bring down the cost of care. The governor is working on some things to bring down the cost of care. But this is happening now. And so, I think of rural hospital sustainability, and if this starts showing up as people avoiding primary care, people and
Oh, yeah.
ER is more sick, driving a lot of costs that then is not collectible, it's uncollectible debt. Has anyone across the hall looked at the potential impact on the system of this?
Not of this particular proposal, but I think it's, it's known that people who don't have affordable insurance avoid getting needed care. And that has a cost on the system, or that's just so what this does is this helps this group of people have better access, makes their premiums less unaffordable. And people who have access to healthcare are more likely to seek preventative primary care, other services versus folks who don't have healthcare. They're more likely to wait till they're much sicker and don't have a choice and go to the ER, which is much more expensive. So that's just, a sort of underlying baseline. So.
Yep.
The monies that the state has received for rural transformation, can any of that money be used for this?
No.
Bummer.
Yes.
Yeah.
It's what I can say about the rural health transformation grants is they're very specific and restrictive, and there's a very strict list of what it can and cannot be used for. And even the things that we can decide that fit within the category, we have to be very specific in our applications to the federal government, and they follow each of those very, very closely. So even if it was allowable, which I don't believe it is, it would still be another year before we could even apply for the next round of grants to be able to do it. So even if it were available, which I don't think it is, it would not be an immediate solution.
Thank you. Thanks, Dylan.
Thank you.
I know, I see.
And if folks who want to learn more about the Rural Health Transformation Grant, there's a pretty solid presentation from earlier in the session. Somewhere in the internet to be found. So we have sort of a few levers, choices, decisions in front of us to just be thinking through. There's the ways that we were narrowing the original revenue in terms of lowering the rate, changing the VIP tax, all of that. And then there are sort of two different options for using net revenue to improve folks' affordability, et cetera, the healthcare that probably needs some work, and the lowering of middle-class tax rates, which also probably needs some work. So those are sort of let's spend some time tomorrow thinking through sort of those three buckets of conversation together. So next up, we are shifting gears slightly. And we are going to hear from Kevin Chu from the Vermont Futures Project. He did a study on economic momentum that we heard about from the Chamber of Commerce last week. Folks wanted to hear more about that study. Thank you so much for coming in. Sorry, our schedule is all wild today. Thank you, team, for being here. And so this is in the context of the committee bill that we're looking at, but it's stepping a little bit back from the details and more into the big picture. Thank you for being here.
Thank you, Chair Kornheiser, for the invitation. Thank you, members of the committee, for having me today. I'm getting connected to the Zoom so I can share my screen, and then we'll dive into the conversation. That gets pulled up, I'll say a little bit more about myself. So my name is Kevin Chu. I'm the executive director of the Vermont Futures Project, and the Vermont Futures Project is a 501c3 nonprofit, nonpartisan. We focus on education and research related to the economy. So let me queue up slide deck here.
as I mentioned, our work is nonpartisan. We are designated as a 501c3, so I'm not a lobbyist. My role here today is education and sharing information to help you with your work and decision making. To center the conversation, I'll say a little bit more about the mission of the Futures Project, and it's to answer this mission question, which is how can we use data to support the evolution of Vermont's economy towards a thriving future full of opportunity for all. Now, just to set some context for economic momentum, because I know that was what I was called in to testify on, it is one component of our economic competitiveness dashboard. And we'll have an opportunity to dive into the dashboard and take a look at all the details. But the dashboard itself, for an overview, it's a compilation of a range of indicators that show where Vermont ranks relative to the region and relative to other states in the nation. So the rankings in the dashboard are sorted from 1 representing the highest relative performance to 50 or 51, depending on whether DC is included in the underlying data set. And 50 or 51 represents the lowest relative performance. Taking a look at all of the indicators in totality, the data certainly reveals some strengths that Vermont has, but there are far more areas that need urgent attention. And the dashboard serves as a basis for comparative analysis. If we see that certain states are doing quite well on metrics, we can zoom in and start to ask, what are the strategies they're pursuing? What are the policies that they've implemented? What are the ideas that have helped them outcompete Vermont? So going into the dashboard itself, as I said, I was called in to testify on economic momentum. That is just one of 9 composite indices that we have on the dashboard. And the squares there, the blue squares, are the composite indices. And then on the other side is just a list of some of the component metrics. Like I said, we'll be able to dive in so we can take a look, but I want to zoom in on economic momentum since that was the topic of interest. It is a composite index that was developed by Camoin Associates. They are an economic development consulting organization. They've done work in the state of Vermont, including helping with the Southern Vermont FED's Comprehensive Economic Development Strategy. And they've done a few other economic impact analysis, so they're aware of the Vermont ecosystem. But their national work on economic momentum is based on a model that includes these component metrics: population shifts, which signal labor and consumer demand; employment trends showing job creation; macroeconomic output reflecting economic health as measured by gross state product. And then in terms of the business friendliness portion of their model, they look at entrepreneurial signals like business starts, tax structure analysis. And the results is a ranking of states that have experienced momentum in key growth categories over the past 4+ years and are poised for long-term success. So this was copy and pasted from their report, an explanation of how they define economic momentum. So what I've done is compiled some of these component metrics on the next slide so we can see how is Vermont doing on these relative to other states. So these are the components of economic momentum. Population shifts. We rank 49 out of 51 in terms of absolute change based on the most recent estimates of population change, and 51 out of 51 when taking a look at that number as a percent change of overall population for a given state.
What does that mean?
That means we lost, in the latest estimates, a total of 1,858 people.
I guess I'm, in the context of economic momentum, a person isn't a person, right? So are you able to drill down further into sort of who is moving, who is coming, who is leaving, what that?
That type of data would be available from IRS data sets on who's moving from state to state.
But when you are in this indices that we're looking at, both absolute change and percent change seem to me to be somewhat irrelevant to economic momentum because the age of that population, the education of that population, all of that is even where in the state that population is moving is so much more important than the actual number of people.
Yeah, the population shifts, these top line numbers are a starting point.
Okay, great, okay.
To your point, there can be a
And
deeper
we're gonna-
examination. I'll pull up the dashboard afterwards, because yes, there's an age component, there's an income component, there's an education component.
Okay,
But I wanted to have a clean summary slide.
okay, great, sorry.
The top line indicators. Employment trends, we rank 46 out of 50 in terms of percent change over the past 12 months. We've seen employment decrease. There was a story just this week about this continued trend of employment decreasing from recent peaks. And then macroeconomic output, 50th out of 50 for absolute GDP, which isn't actually that big of a surprise given how small of a state we are. That's been pretty steady. In terms of per capita GDP, we're 37th out of 50, and we've actually seen that trend upwards over the past 5 years, and that we've climbed that ranking. Business starts, 50 out of 51 for net change in establishments over the past 12 months, and 45 out of 51 for net change rate, and that's been dropping. And then, yes.
Oh, 1 second, Representative, let's finish this slide. Oh, thanks.
And then tax structure, 42 out of 50 for tax competitiveness, according to the Tax Foundation state competitiveness rankings. 50 out of 51 for effective business tax rate, according to Ernst & Young analysis. And again, we can dive into the details of what goes into that. And then number 3 out of 51 for tax progressivity, based on the Institute on Taxation and Economic Policy. I forgot to say at the beginning of this slide that red text indicates that we're dropping in the rankings. Blue means that it's been relatively stable, and green is where we've made an improvement.
Then unemployment trends, is that total employment with unemployment rates included, precluded? How does that?
Total number of people employed, unemployment in Vermont is about 2.6% right now, quite low, one of the lowest in the country. And that number, 2.6, it's hovered in that range for quite a while as well. So it's not including the people who are seeking work, it's just the number of people who are employed.
Thank you, Representative Woody.
Thank you. So, like, the chair's question earlier about who is coming in and out, the breakdown for the business starts. Do we know, are those business starts, what are they paying their employees? What are their benefits that they're offering? What kinds of lives do those employees have? Is it very, very low pay? Is it without benefits? Is it without knowing what their work schedules are?
Yeah, I don't have the specific data down to the business level, but in terms of broader trends, median household income in Vermont has been increasing quite rapidly. It's had the 3rd fastest rate of growth over the past 5 years, and we rank in the top 20 for median household income. And again, that's one of the components in the broader dashboard itself. And after this presentation, I can swap to my browser and then we can click through the dashboard and just follow your curiosity as to what I click on.
Yeah, sorry, go ahead.
Thank you. I just wonder, it might seem positive to have more business starts, but when tax policy all by itself, what is it? What could it be? I'm wondering, what is it? Who is it encouraging and discouraging from creating more jobs? And what kinds of jobs are they? And what kinds of lives do the people lead who get those jobs?
Yeah.
I just, is there any way that you would be looking into that more?
I certainly could as a follow-up. This slide is just meant to capture the components as defined by Moynihan Associates in their economic momentum rankings. But as you'll see in a a few moments when we take a look at the dashboard as a whole. I try to bring in as broad-based of a variety of data as possible so that it becomes a resource to the general public, it becomes a resource to you all. So you have that underlying data available to you when considering the topics of how to make our state more competitive and to help improve the economy.
And sorry, just one other quick question. Business starts, is that like filings with the Secretary of State's office? What is a business start?
Yeah, so this data that I've included comes from the US Census Bureau, and they track the number of new establishments that get created, the number that close, right? So that's how they track.
What is an establishment?
Establishment is a little bit different than a firm. So those are two separate definitions within the US Census Bureau data set. A single firm may have multiple establishments. So think like, a restaurant that has multiple locations in multiple towns. Each of those restaurants in separate towns would count as an establishment, even if they are under a single business entity. So the numbers here represent establishments.
Thanks.
Sorry. Yes. Is there, I appreciate that the macroeconomic output has the per capita number on there. For business starts, is there a per capita reading for that? Because I'm just, we're roughly equivalent in population to the city of Boston. If the city of Boston had 70 new establishments open up, that seems like a great success, right? So curious as to if there's a per capita rating for.
Yeah, great question. And that's why I included the net change and net change rate, because the rate takes into account how many total establishments within the state. So both figures are included there, so you can see both the absolute change and the rate of change based on the underlying amount within a given state. All right. So
At this point, we will let you get through your whole presentation.
okay. And just to zoom out, so economic momentum, I mentioned that Camoin Associates ranks Vermont 51 out of 51, but I wanted to give you the big picture of how other states are rated throughout the country. These takeaways here, these come from the Camoin Associates report itself. They identify a cluster of states as lagging behind, which includes Vermont, so West Virginia, Hawaii, and Vermont. Their takeaway is that these states struggle with population loss, limited economic diversification, and slow job growth. And these states need to rethink the basics and diversify their industry, invest in talent, and create a compelling case for why businesses should take a second look. Again, these are takeaways from the Camoin Associates report. I want to take a step back just to differentiate between scores versus stats. And I'm going to use the scoreboard as an analogy. So this is scoreboard. We love that the Catamounts won this game 3-2, right? But you'll see there's a few other stats included: shots, fouls, corners. And this is an important framework when working with data is what is the score we're tracking, right? Because there are a lot of possible stats that we can include in the conversation. So the economic competitiveness dashboard that the Futures Project has created includes many stats. Even the composite indices, I would consider these stats, maybe advanced stats because it takes a bunch of components and tries to come up with a more insightful number or ranking based on the composites. But at the end of the day, part of how we've been keeping score through the work of the Vermont Futures Project is centering the work on people and places. So at the top of the dashboard itself, we include population change and housing, and recognizing that these are lagging indicators. If we do the right things, implement the right strategies, make Vermont more of an affordable place that's viable for economic growth, then we'll see these numbers shift in the long term. But having that framework of scores versus stats, I want to make sure that we keep that in mind as the conversation unfolds. So in terms of score, population change, and cost of living, I intersected these data sets, and you'll see this in the dashboard itself, just to try to understand nationally, where are people moving to? Where are they moving from? Where is growth happening? Where is their decline? The latest population estimates show that Vermont is the only state in the country that is experiencing both natural population loss and negative net migration. So what I mean by that is every other state that is losing population due to natural changes, so more deaths than births, those states are gaining population from people moving in. Every other state that is losing population from net migration is experiencing natural increase. Vermont is the only state that's losing on both fronts. Additional insights from the data, Vermont, I mentioned, we're losing population. We're one of 5 states with estimated population loss. Vermont had the fewest estimated births of any state. Of the 10 most expensive states, 9 experienced negative domestic migration. So this is one of the components that we can dive into in the dashboard, is that population change has a few different components in it, and domestic migration is a good indicator of where people are moving to and from versus population change number itself. Gives a little bit more specificity. And then in general, domestic migration is away from high cost of living areas towards low cost of living areas. And when we take a look at the components that make up cost of living, housing is the major driver in most places with high cost of living. So I'll wrap up there and then shift over to a different screen with the dashboard.
Can I ask a question about that? Does that analysis just look at domestic migration? Because we were talking yesterday, we had a demographic brief from JFO that showed we had, if international migration was taken into account, we actually had a net migration increase of around 1,500 people. So does that previous analysis you were sharing on that map only look at domestic?
It looks at both. So here's the competitiveness dashboard on our website. Here's that last map that I showed in the slide. In our dashboards, if you pull it up in a browser, the data sets, most of them are interactive in that you can hover over and see the components here. So you'll see net migration captures both domestic and international. And it also shows the natural change, so births versus deaths. And then as I scroll down.
So sorry, just on that point, I will just point out for the record that the numbers that is showing is different from the numbers we got.
I think I took a look at that brief and the numbers that you saw were through 2024. This is the 2024 to 2025 estimates.
Okay, so still net housing gain, but yes.
Yeah. If I had shown this map with just data through 2024, it would have aligned with what you saw yesterday. It comes from the same underlying data set. It's components of population change from the US Census Bureau American Community Survey. Any more questions on this one?
I guess I'm struck with sort of some of the colors are cost of
The colors
population
show,
change.
yeah, population.
So I see some quite low cost of living areas there as well that are in dark blue.
Yeah. And we can hover over it. So you'll see the population loss in the state of Mississippi is driven more by natural change, whereas they have positive net migration, a significantly greater amount of international migration than domestic into Mississippi, right? So you can hover over each to try to understand what's going on within that state itself. The color coding is just based on that top line population change. In some areas, that change might be driven more by migration, and other areas that might be because of natural dynamics.
Yeah, thanks.
And then the labels are cost of living index. So I'll hover over. These are the states. The color's not great here. These are the states that are gaining the most population, right? And then as you move over to the right on the legend, the farther you go to the right, the darker the shading becomes, the more or the less population is being gained with 5 of the states experiencing estimated loss. So with each of the composite indices, right, there's the short summary of where we're ranked, but if you hover over it, you can also click to see the underlying data set. And then I'll just slowly scroll through and tell me what to click on. What do you want to examine? I'm here as a resource.
I know you've spent a lot of time looking at net migration and net population change, and I've certainly heard people talking about how New England is really, especially given international immigration changes at federal level, how New England is in some ways just sort of the bleeding edge of what the entire country is going to be facing soon, and that many other countries around the world are facing right now. And I'm wondering if you've been able to look at Germany, Japan, to say, like, what can we learn from how they're grappling with something that they've been wrestling with a little bit longer than New England has, that we could be taking into this?
Yeah, I haven't done too many international comparisons from a policy perspective, right? Because US policy is so different.
So very
than
different, yes.
Japan or Germany, and then there's the nuance of what each state is doing within a national context. But you mentioned Japan, so I have just examined some of the dynamics happening there, and certainly from a natural population change perspective, they're far ahead of the demographic curve that Vermont is trending towards. And it's also a country that historically hasn't been that open to international migration. And they've seen a stagnating economy over the past couple of decades, right? So are there lessons to be learned there? There's lessons to be learned anywhere. So how do we want to adapt that to a Vermont context?
Mm-hmm.
So Kevin, it's interesting to think about Vermont. It's always had this history of population losses, different times, and then some population, I believe, back in the country, the whole advertising campaign, the late 60s, early 70s, had a population increase. But just looking at the average momentum in the population changes over time, where we are now, are you thinking I don't want to put words in your mouth. I think that we are at the other side of a bubble of a long-term population gain from the 1960s and 70s, peaking and going on the other side. I'm not sure. I wonder what you think about that when looking at Vermont's history.
Yeah, great question. So we definitely experienced steady population growth from the 60s to the 70s, the 80s, 90s, and all the way up to about the year 2000. Past 2 decades have been a bit of an outlier in that there's been this plateauing or stagnation of population growth. So the past 20, 25 years looks very different than the preceding 20, 25 years. If you want, I can sort of pull up what that looks like in a different window.
Maybe later, yeah.
Okay.
Following on Rep. Kimball's sort of general thoughts, not specifically. But over time, Vermont has seen losses of population and increases of population. And a lot of that has been based on the economy of Vermont. I mean, granite industry comes and goes, sheep comes and goes, various kinds of things comes and goes, baby boomers, back to nature. And my reflection is just, there are clearly indications, things, nuggets in your presentation that we could use.
Yeah.
But I'm just reflecting a lot of the result historically has been based on vectors of which we haven't had that much control over. So we just need to keep that in mind. We can do what we can, but there are no silver bullets out there, I guess I'd say. But if we can find some and build on them, then okay, good, let's try it,
Yeah, one of the points that Camoin Associates made in terms of the lagging states was that economic diversification could help turn things around. To your point, we've seen some ebbs and flows in population based on some of these periods of boom and bust for certain industries. An economy that has more diversification can weather the storm if a single industry is experiencing headwinds. So that to me was a really important takeaway from their report. We become overly reliant on one or two major industries that might set us up for a vulnerable position moving forward.
Representable.
Except ironically, there are smaller states, smart plays is about focusing narrowness. No, and we don't have oil, so we can't be Wyoming
Yeah.
or North Dakota, but we, when you look at South Dakota, Delaware, and Wyoming, which would be the small state smart plays, South Dakota's the trust that we were talking about. I mean, I suppose it's us, ours is captive insurance. Is that what we're trying to say from Camoin is the strategy to figure out how to do captive insurance and just stay ahead of everybody else on captive insurance?
It's, yeah, where are our relative strengths that we can lean into and expand as a competitive advantage, and that gives a good foundation to build from.
The other thought I would just have is that two of the least competitive states are also the ones that are the largest donors in terms of federal tax payments. And so if they're not competitive, but we're completely, in this state, we depend on federal transfers.
Yeah.
It'd be concerning to me if we're saying that the states that are basically paying for us are the ones that we don't like. So just a thought. Yeah, I mean, California and New York are big donor states. They contribute far more to the federal government than they receive back from the federal government. We receive more from the federal government than we get.
Miss the last three words you said.
Yeah.
I think what has this firm does work here? Are there suggestions they have for where we could diversify, and what do you need in order to diversify?
Yeah. I think that would be a great question for Camoin Associates themselves. I believe they put together the rankings as a way to receive those types of phone calls so that they can be consultants on.
Can we all be so lucky?
But it's part of why in the dashboard itself, we don't lean on any single report from any single organization, right? And we try to collate and aggregate across a variety of organizations, across from a variety of data sources, whether it's the Census Bureau, the Bureau of Labor Statistics, Bureau of Economic Analysis, the Vermont Department of Labor, and bring it into a one-stop shop resource that you all have access to and can compare, right? Because any single organization, any single individual will bring their own biases and perspectives into how they assess data. And this is why I said there's a difference between scores and stats. But when we look at all of these pieces in aggregate together, right, it helps us to understand, okay, if multiple sources and multiple organizations are saying similar things, there's probably some truth in that.
So I'm concerned about a few things. One is new business starts. And because of typically, someone who's starting a new business is not necessarily looking at the tax rates of a business or that kind of stuff. So they might be looking at the professional resources available, the talent. I'm wondering if within Camoin or with the research you've done in terms of looking at the new business starts, why is that? Why do we rank so low?
Yeah, again, this is where I look at it in aggregate, and I'm sure many of us in the room have heard the phrase, Vermont isn't a business-friendly state, right? And that's not just tax policy, but sometimes it's access to technical assistance and resources, incentives, networks and industry clusters where you can learn from and get support from peers. Those are all factors in economic development. Business starts, right? Businesses need to pencil out. So if at the end of the day, when you add up all the costs of doing business and it's not earning a profit or just barely break even, that's a very difficult pathway to pursue.
Yeah, it's interesting because we bend over backwards to try to create incentive programs and other things at a state level. But there could be some fundamentals that we're not addressing or can't address adequately at the state tax level or other levels.
And I would just add that, in addition to considering incentives too, one of the sentiments that I hear from the business community is there may be existing barriers, and making progress in improving efficiency is also a way to improve the business climate.
Not sure what that means.
It means that if there are rules and regulations or fees that are a drag on their business operations, helping to alleviate some of that pain is just as helpful as an incentive itself, because at the end of the day, it's like, what is the bottom line when you add up all the pluses and minuses?
Yeah, make it easier.
Representative Page?
Yes, you came to Newport a few months ago, and a number of us.
Lovely visit.
And a number of us legislators and community members enjoyed your presentation. I wouldn't say enjoyed, but it was, we found it,
Sober?
yes, it was so, actually. At that presentation, and I've seen other presentations that you've done, you address mainly housing issues and how much we need more housing. And it seems if we did put a lot more emphasis on that housing, maybe some of these other areas would rise to a different level. Could you address that a little bit?
Sure. Yeah, a constraint to business growth is workforce considerations, right? And I mentioned that in terms of trends, employment has been trending down, right? Fewer people in the workforce, while unemployment rate has stayed relatively low and steady, which when you put those two things together, it means there aren't enough working age people looking to participate in the labor force. To grow our workforce, we need to take a look at what are the inputs, what's the supply into the workforce. So those are our high school grads, those are college grads that we retain. Those may be people moving from elsewhere, right? And that's captured in the economic action plan under that people pillar. But practically speaking, in order to grow that workforce or grow the population, we have to have enough places for those people to live. So even if there's the desire and the demand to grow and to expand the number of job opportunities, if there aren't enough people to fill those jobs, then that becomes a major impediment to further economic growth. But because there was a question about sort of the historical trends of population and how that impacts our current situation, in 1970, median household size in Vermont was 3.21. Today, it's about 2.18, right? So I highlight that to say that even if a population size stays relatively steady, the housing needs of the population can change, because as we move through different phases of our lives, our housing needs also change. And if the housing environment doesn't adapt to those changing needs, then that can put pressure on housing. It's part of the analysis to show that we need more housing simply for the people who are already here. Because if our median household size today were the same as it was in 1970, Vermont would have over 900,000 people. We don't. Yeah. So practically speaking, if we bring it down just to the household level, right? Let's imagine a family of 4, 20, 30 years ago, and let's say it's 2 adults, 2 kids, they purchase a 4-bedroom house. Now those kids have grown up and are searching for their own housing. If we didn't build any in the community, they don't have the option to stay unless they stay at home with mom and dad, or they've moved out of state. And now that 4-bedroom home may be occupied by 1 or 2 people. And the only way that we can unlock some of that latent capacity, the extra bedrooms, is if we build enough new units for some housing mobility within the market. If someone wants to downsize and there's nothing to downsize into, they're going to stay put.
Thank you. Thanks so much for joining us. Really appreciate it. I imagine we could all do this all day.
Yeah.
And
I
I imagine
encourage
that
you
happens
to-
whenever you show up somewhere, but I'm glad that we have the dashboard to dive into.
Definitely, yeah. I encourage you to go onto the dashboard, play around, click on any of these, and it'll open up the component metrics there. There was a question about international versus domestic, so that's all captured here. There's some housing metrics, economy and business metrics. And I try to update this with new data sets as they become available or are sent my way. So the job growth one is a relatively new one. Right, and in the tables, I just wanted to highlight this before signing off. The blue states, or the ones highlighted in blue, are the New England states. And then I've tried to make it easy to find Vermont by highlighting it in green.
Thanks.
Cool.
Thanks so much for coming in. Really appreciate it.
Thank you.
Folks, we are done for the morning. We are on the floor at 1. I believe Representative Page has a bill up for action, and then after the floor, please come on back because we are ideally voting on 2 bills.